case focusing on the affordable healthcare, use of venipuncture.
Okay. So, hello all. My name is Trivikram. I'm a master student from IDC, currently doing my second year in product design. And I'm here to talk about my final year project called as low-cost vein detector for Indian scenarios. This project falls broadly on the area of affordable healthcare. So, why healthcare? Let me start off with a small quote, which is, "He who has health has hope, and he who has hope has everything." This has been a kind of a motivation for me to take up this project. Let me quickly talk about the introduction of what is a venipuncture, for which I am designing my product. Venipuncture is a very simple conventional method of using a needle to either withdraw or inject fluids into human body. But the problem arises when a person can't find the vein, right vein, in the first single attempt. In that case, the nurse or doctor needs to do multiple venipunctures to find the correct vein. This causes a lot of pain and trauma to the patients. So this is where I thought about making a new product which would help solve this problem. And this is rightly the need of my project. And let me start off with few statistics. Almost 16 out of every 100 venipuncture process needs a multiple venipuncture, which means every 16 people undergo at least more than once a venipuncture process which involves multiple prickings of the veins. Just imagine the kind of pain and trauma that undergoes, and this number increases exponentially when it's a child. Almost 2.25 attempts is taken by every child to find the right vein. And almost 6.25 minutes is lost during a single venipuncture process. For a healthcare sector where almost every second gain is equal to every life saved, it's a big hurdle to overcome. Talking about the societal impact, what this product would have is, by having multiple venipunctures, the kind of problems one faces are having swelling, irritation, bleeding, having blood clots or blackening of skin. Not just this, when I did a preliminary research of the users in the various blood banks and government hospitals and private hospitals, one interesting fact I found was, many blood banks, for example, especially when they call in the blood donors, what happens is, if they can't find the right vein, they don't go on pricking your vein. They instead reject the donor and send them back. So if you take a big picture, this causes a lot of reduced blood collection in a blood camp. So just imagine, if a product of this kind is used in a blood camp of a scenario where you can't find the right vein, just imagine how much of more blood can be actually collected in such blood banks. So the uses are pretty diverse. So my target users are 4 kinds. The children, the geriatrics or the aging population, the obese, and the normal people who have deep veins, who can't find the veins easily. And let's talk about the motivation why I chose this topic. Is because the primary reason that I am interested in healthcare products. These are products that I've designed in the last 1 year, which is actually a growth aids for cerebral palsy, and in collaboration with MIT Media Labs, I've been designing a sleep apnea mask. So this has been an interesting field for me, so that's why I took it forward. And the second reason why I chose this topic was because of the awesome course structure we have in IDC. There's a subject called as collaborative innovation, wherein we students were expected to go on field visits and visit the blood banks and hospitals and come up with design opportunities. So one such opportunity is what I have found here, which is using a vein detector to find the difficult veins. So, why is my product frugal innovation? So these are the 5 different kinds of products already present in the market, which will help you find the difficult veins. But these 5 different products can be categorized as 2 different structures called as contact devices and non-contact devices. Contact, I mean, basically the device will touch your skin along your forearm, and then you will find the vein and do the venipuncture process. Whereas non-contact will superficially go over your forearm and then you do the venipuncture process. But the one common feature with all these products are they're extremely costly. Okay. For example, if you say this product, it's called as AccuWing, it comes close to $4,000 rupees. So $4,000, which is closely 2.5 lakhs, which definitely a normal small clinic in rural areas of blood banks cannot afford. And one more interesting fact is there are so many such products in the market, but none of them are made in India, and very few of them are being used by Indians. So, in order to find what is this affordable cost or the frugal cost for people to buy it, we did a lot of number crunching and we went displaying some questionnaires to various blood banks. And at the end of the study, what we found was this product needs to be in a category of close to 1,000 rupees. Anything more, people don't want to buy it. So this was the target price that we took, and this product is taking forward. So coming to the product development phase, me being an engineer by background, I went on to make some technical circuit configurations to identify which minimum circuit configuration and which minimum LED size needs to be used for designing the most efficient vein editor. So after doing multiple iterations, we came up with one prototype which could give a pretty good veins. The lights are not pretty clear, so you can't really make out the veins over here. So then we had to make multiple ideations to make that concept into a more end-to-end product. So after doing multiple ideations, we came up with one promising concept, which is now in a frozen stage, and we'll take it forward to the actual prototyping stages. The challenges which I faced during my journey of this product development are broadly into these 5 categories, which are healthcare. Because talking about a healthcare product itself also tells you like what difficulties you face into it. For example, the material you choose needs to be biocompatible, and you have hundreds of standards that you need to comply with, FDA approvals. And for example, last week I had an ethics committee meeting because my product, if I want to test it with the users and refine the product later on, I need to have this ethics committee approval. So this happens once in 2 months in IIT. So I literally had to wait for 2 months to get the committee's approval and then move it to the user testing. And coming to the technology part, figuring out which circuit configuration will actually help us do the ventilation more efficiently. And after finding that circuit configuration, which actually make a portable device, which helps you more, which makes the entire device more compatible to use. And then the most important hurdle of cost factor, because I'm talking about multiple iterations. Some of the LEDs that we bought from Germany and things like that, which turned out to be very costly. So this development cost is one hurdle that I faced, and the next is the target cost. As I told before, the entire product needs to be like close to 1,000 rupees. So I need to make all the things equally safe, the quality should be good, and then also meet the target cost. And coming to the timeline, the last challenge, this being an academic project, I need to finish it within 4 months time. So I need to be ideating quickly, I had to make a concept, make a prototype, a mock-up, and get the ethics committee meeting, do a user study, refine it, and then make a marketable product. So it's a lot of work in a short duration of time. So if you ask me a question, is IP relevant to my frugal innovation? I would say definitely yes, because of these 2 reasons, which are having an IP is basically a recognition or an encouragement, a boost you give to the innovator in order to understand what you've done is really good and to do more further such projects. And second thing is to avoid inventing the wheel again and again, because once when I say, okay, I have done this product of a vein editor, by filing a patent, probably the next person can say, okay, this is a benchmark being set, I'll probably leapfrog from here. So I feel that could be the possibilities of having this IP patent for my innovation. The next question which I was asked to address was, would I like to keep it as an open IP or proprietary IP? For this, I really don't have much knowledge about it. But when I give a thought about it, what I would say is, for my specific project, it's a combination of both. Because I need to keep it open, because my target segment is the rural area. It needs to go out in the public and serve more people of small clinics and blood banks. In that case, I would be more than happy to give the concepts out so that somebody else can actually manufacture it. But it also needs to be proprietary because it's done under the umbrella of IDC and IIT Bombay. They are the ones who give you the resources and the necessary funds and grants. So definitely some credits needs to go for them also. So I don't know how this is going to fall a thin line between being open and proprietary. So that's pretty much it. Thank you.
very known now automotive product is case study by a team focusing on the lessons learned from Tata Nano.